Hello, and we are back here at the SWAAC ELSO conference. And my name is Lajuko, and I'm the guest correspondent of the podcast. And today I would love to introduce to you Dr. Vivek Kakar. Did I pronounce that well? And I'd love for him to introduce himself before we jump into some questions.
Thank you for having me here.
Thank you.
I am Vivek Kakar, and I work as a critical care physician at the Cleveland Clinic Abu Dhabi, where I also lead the ECMO program. And I've been here for the past 9 years, and I was asked to come and help set up this program. Before that, I was at King's College Hospital, London. Here also, I was part of the ECMO program that I have developed. And yeah, the 9 years have gone by so fast.
You're almost local. Okay, so we've set up a few questions. I might ask a few follow-up questions in case you say something super interesting. So first question, how do you see this conference shaping the future of extracorporeal life support therapy?
This conference has exceeded all our expectations. Yes, 1,100 people, this many countries. Yes, every continent is represented here. The region is extremely well represented here. And I think that tells you two things. One, obviously, that the community that is involved or engaged with ECMO is growing. And second, I think we're breaking this paradigm where, when you do super specialist stuff, it gets reserved to a very small super specialist group of people.
Yes.
But ECMO is more than that, because people who have cardiac arrest need ECMO. People who may start with a simple flu but end up on ECMO. Yes, the lungs fail, the ventilation doesn't work, they end up on ECMO. People who start with a simple palpitation then end up finding out they have a heart failure, the medication don't work, they end up on ICU, they end up on ECMO. So ECMO, is it just,
It's not a one, yeah.
no, yes, it is the intersection of so many illnesses and diseases. And so I think that we've broken that paradigm where people think of, pigeonhole ECMO as just a therapy. Because we've learned that ECMO outcomes will improve only if we take our efforts step back. If we improve the way we care for people with lung failure or heart failure, we'll select better people for ECMO, we'll do the outcomes.
Yes, very
So
true.
now I think we're able to engage a much broader community. Yes, the cardiologists are interested, cardiac surgeons are interested, thoracic surgeons are interested, anesthetists, intensivists, so dietitians, you heard physiotherapists speak about this. So I think now we're seeing the two multidisciplinary kind of engagement through the therapy that is actually the multidisciplinary in its concept.
So I believe it's genuinely, truly bringing the community together. Second question, how have you or do you feel you will professionally benefit from your attendance and speaking at this conference?
Well, look, as a co-chair of this conference, I kept my speaking engagement off for this time because there are so many administrative areas. But as attendance, we designed the scientific program. Dr. Praveen designed a fantastic scientific program. Our focus was for this to be a nuanced discussion. We did not want to have a repeat of the topics that have been discussed, ad nauseum. You wanted a little nuanced discussion, the things that even the most proficient ECMO specialists would be interested in listening. That's the feedback we've got. Yes, we've got 70 speakers from all corners of the world, people who are really leading the areas of development. And the comments I've gotten, Vivek, the agenda is phenomenal. We were ourselves interested in listening to the topics, so it's not just the delegates who are starting this journal, even those who have been doing this for years and years. That I think, so I'm personally going to benefit immensely, and I'm waiting for the videos to come online afterwards.
Yeah.
And, so that I can sit and watch in peace when I'm not actually troubleshooting.
So your mind is not in different places, you can actually focus on the information. How important is continued education and training for healthcare professionals in this field?
I think continuing education is important regardless of, in medical field, but because this is, we say ECMO has been around since 1971, but actually much of that progress and development that has made it a do-do phenomenon has happened in the last 15 years.
Okay.
Yes. And it's a multitude of reasons. We've gotten clinically better, we've gotten technologically better, and we are more interconnected. So the good information flows past to other people. So we all adopt the things. So I think something that is growing at this pace, you cannot sit comfortably and become complacent. What's, good today may very well become outmoded and outdated 6 months from now.
Very true.
So I think for a fast growing field, something that drives, pulls in patients from broad range of specialties, I think keeping up is extremely important. And that's where this kind of conferences and events.
You mentioned growing fast. Is this speed in any shape or form attached to the AI?
this will be. Already there are several startups that are looking at AI from separate angles, yes, because ECMO is a complex therapy and it gathers a huge amount of data. We only scratch the surface for our clinical purposes, yes. And so there are a lot of AI looking at how to capture. You heard Professor Fraser's talk, and he was working, his team is working on a beautiful data capture technology. Okay. Yes, which means, because these are resource intense therapies. Our time or clinicians' time and nurses or doctors' time at the bedside is best served thinking about how to get this patient off it,
Yes.
not documenting or not charting. Yes. So the AI, in data capture, data integration, and that is big data analysis that we are not even doing at the moment. And then obviously, I would personally like to see the use of AI in decision-making algorithms in patient selection.
Oh, fantastic.
Yes, and I'm going to look, our Department of Health Abu Dhabi is doing a phenomenal job in this. I mean, I think the new Unified Medical Operations Command Center that has come online is leaps and bounds ahead of any other system in the world. And one of the things that could happen with developments like this, when we integrate systems, we integrate providers, is that you use AI-based algorithms to automate the decision making, so you save the time for critical patients.
At the end of the day, the critical patients need you more.
Yes,
Yeah, that's true.
we're going to take ECMO to the field. Yes, people arrest. More than half the cardiac arrest happens in public places or in their homes. And the people who respond to them, they do a great job, but they could use more support, and they have to wait for that till they get to the hospital.
Yes, true.
We provide them with this data. We automate the decision-making process with the data they capture at the bedside,
Yes.
which shave critical hours critical minutes in the first golden hour of research patients. And you could use the same analogy for all other ECMO decision-making.
Well, I would like to say thank you so much for your insights. I truly believe you're doing a phenomenal job. We're excited to have you on board and to have your time to join us for a chat. Definitely hope to see the conference next year. I'm excited to see what you'll be able to bring out then.
Thank you very much. Thanks for having me. Next year will be Chennai, and we're all looking forward to that as well.
Same here. Thank you so much.